So let's talk a little bit about preparation. Now let's just say that we're a female or a couple in North America. They're decided, we've assessed the case, they look like a good candidate for in vitro fertilization. What kind of preparation as an international patient would they need to undergo before they came to Cancun? I mean, would they need any medication in advance to prepare them, to align their travel dates, things like that?
Well, that depends on the time availability of each couple. If you are able to come for the full ovarian stimulation here, which would typically take like 2 weeks, we would just need you to get into oral contraceptive pills just to get your cycle regulated and coordinate things with the airplane tickets and your stay here at Cancun, and to get all your medical checkups in advance arranged. But it basically takes no more than 2 weeks. In exemption for when you're getting special things for PGD, for example, which would require a blastocyst transfer on day 5 or 6. That would require a longer stay, but it's more like 18 or 19 days. If you don't have that kind of time, if you cannot give you a chance to be absent from work or from house for so many days, you can come for the last part of the treatment. But that will require us to get a clinic collaborating with us at your local residence.
So they would need a baseline ultrasound, for example, some hormone testings at the beginning, and to share those results with you.
That's correct. We will need someone to be our eyes locally.
And they would need typically, and they'd also need obviously to start the stimulation protocol at home.
They would need to get their medication there and start the protocol there. If you come here, we give you everything when you come here.
Right, and I think probably that comes with a trade-off a little bit, because obviously that, you know, the one thing I do know from first-hand experience is that medication in places like Mexico or abroad is certainly much more affordable here.
That's right.
So if a person can come and stay longer, it certainly is more affordable in terms of accessing medication, etc., and doing the entire protocol here, as opposed to, you know, they could come for a shorter amount of time, but would need a doctor, a fertility doctor at home to do a baseline ultrasound to provide that initial stimulation medication at typically greater cost.
Yeah.
So it really is a balancing act, I guess.
Yeah, but to clarify myself, I'm not recommending to do the shorter version. It's much nicer for us and for everyone. It's even cheaper to do the whole treatment here. But if you are not able to come for so many days, that does not mean that you that you are not a candidate for IVF treatment.
Absolutely. And I do know sometimes with, because once again, from personal experience, I do know that sometimes a woman will come by herself for a period of time, and then we need the male partner for typically a couple days to give the semen sample, somewhere around day 10, 11 of the process. So in terms of a timeline of all this, then, let's just say someone was to come to you on day 1, they would typically see you at the clinic.
That's right.
First appointment, they already have assessed your case, they meet you, would they typically do a baseline ultrasound with you to assess the endometrial lining?
We will do a follicle count, and taking in account the age of the patient, the medical history, and the baseline count of follicles, we would determine the correct amount of medication that you will require for the next days. So typically we start with 2 days, on day 2 of menstrual period, with a fixed dose of medication, and after that we ask them to come by and get an estradiol test on day 3, very early in the morning, because we can get the results in a couple of hours, and we can adjust the dosage of that day and the next 2 or 3 days in advance. So we ask them to get the injection in the night, at night, and that way we can adjust dosage. Then we start seeing them every other day for ultrasound scan and estradiol levels, and whenever they're ready, we just 36 hours in advance we give them the last triggering medication, which is called, which basically changes the final maturity of the oocytes, and then we do the oocyte retrieval with some requirements that we just need them to come fasting for the anesthesia reasons, and that's about it.
So they do, would you say approximately 10 days of stimulation medication?
It's yeah, that's an average. That's an average of 10 days. Sometimes require less, 8 days or 12 days, but that's an average 10.
Right.
It's fair to say that 10 days. And from the day you start to the day the oocyte retrieval takes place, it's an average 12 days.
And I think the nice thing about IVF too is that, you know, as opposed to traveling for other medical procedures, is that really one can be a tourist. I mean, ultimately they're here, they'll see you, you know, relatively regularly for maybe an hour to monitor the follicular growth and things like that. But the rest of the day is really theirs to read a book or go to the beach or be a tourist, at least until, you know, from my own personal experience, until those follicles are getting a little bigger and maybe you're feeling a little, as a female, feeling a little full and maybe you want to relax a little bit more. But until that period, until aspiration, until taking those follicles out, I mean, I really see...
You're free, perfectly free. And it depends more on the personality of the couple. You know, sometimes they prefer to go to the beach and read a book, as you say, or you can go to any of the ruins, Mayan ruins that we have here. You can go to Chichen Itza, Uxmal. There's a lot of things to do around here.
I think that's one of the huge benefits of Cancun. I mean, there is a reason that Cancun is the #1 tourist destination in Mexico and the Caribbean.
That's right.
I think we get 20 million visitors here a year now. I mean, direct flights from any major city in North America. Second longest barrier reef in the world. Some people consider some of the best diving and snorkeling in the world.
That's right.
Obviously, the Mayan ruins are, I mean, Coba, Chichen Itza, I mean, Tulum are very, very close. If you're
very close.
If you're an archaeological, you know, you like that sort of things. Or, I mean, the one thing I like about along here too are the cenotes, the sinkholes.
Sinkholes, that's what you call them, right?
Yeah, they're amazing. I mean, if you've never experienced them as a tourist here, I think they're phenomenal.
You should do that, definitely.
Yeah, fantastic. So then they would have aspiration. So we measure those follicles, we monitor those follicles, and they're basically, we're taking those out at we're looking for a very specific size. We want those follicles to be all very, you know, to optimize their chance of success.
Yes, there are two ways of measuring them. Once you go with the biggest diameter, well, we use medians. We go to measures, and when we have them between 16 and 8 millimeters, we retrieve them, which is the other name of just a follicle aspiration or oocyte retrieval is the same thing. Mm-hmm. And on that day we do the fertilization. If the semen sample is required, so we could do an ICSI or a PICSI or an IMSI, which are the variations on this kind of technique. And we will check on the embryos the next day to see how many embryos we have, and we will call you. That's what we typically do. We make the patients part of the experience. We want them involved in the whole procedure, so we inform them every day of how the embryos are developing, how many they have, which one looks good, which ones are not so good, and so when we come up to the end of the embryo transfer, they're quite know everything has been going on, and they feel a part of it, which is an important thing, I think.
And as again, one has personally been involved in this, I do find that the experiences at a place like this is much more personal.
That's
I mean,
right.
you're their doctor. Their experiences with you through the whole process. You walk that together as a team. And I've had experiences in my life in the past where really at very large clinics in North America where, you know, teams of doctors, and we never saw the same doctor, you know, twice. And it was a very, I mean, the experience didn't have that sort of intimate feeling that really a fertility treatment should have, in my opinion. And that's why, you know, the cost savings, the holistic aspect of the stress reduction.
Yeah.
Because I mean, that's another thing I do know from firsthand. Some people try to do this at home, and they try to live their normal lives as they're doing it, trying to work through the process, maybe that clinic is an hour away and they have to go back and forth every day anyway, so their work life is being impacted.
Yeah.
You know, they're going to need to take time off anyway after aspiration, you know, when they take the follicles. After embryo transfer, we certainly can't be doing, you know, exerting ourselves after embryo transfer.
At least one day.
At least, I would think. And this just, to me, makes, you know, so much sense. I mean, we often talk about stress, you know, being correlated to fertility, and I can't imagine a more beautiful place and a more beautiful clinic. So
Thank you.
I want to take this opportunity to thank you for explaining some of the aspects of
You're
IVF.
welcome. I love to do it.
And hopefully that we'll see people here coming to lots more international patients. I know we're already seeing a lot of international patients starting to come, and I think that is just going to continue to grow when more and more people learn about what a great destination is.
Thank you very much.
Thank you.
We hope so.